Post-op rhinoplasty instructions. Very simple. You've had your splint taken out, everything's done. There are 4 things you need to do. The nasal quart, which helps to correct a lot of the swelling. It's a topical steroid, simply saline 10 times a day at least, each nostril. The mucopuricin ointment up inside your nose, which I'll show you, and then steri strips, short and long term. So the first thing and the most important thing is probably the simply saline. Make sure you get something like this. This is a very good brand, and you can see when it's sprayed, it disperses up inside the nose. And Joni is just going to, we're not going to inject it in her nose, but just put it, and you put it up inside your nose and you inject it and you squirt it 2-3 times each nostril, and that really helps to moisturize your now healing mucosa. Very important. I have you use this 10 times a day, sometimes more if you live in a dry climate, for several months. Very safe, very simple. The next is nasal quart. It is a intranasal topical mucosal steroid. Very safe. You can use it year-round, and it's also a spray. And I have you use 2 puffs each nostril, twice a day, morning and night. And again, the patient puts their nose up, and they can squirt it up inside the nose. Squirt, 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 twice a day. Very, very important to do. Okay. Of course, all these are new. This is mucopuricin ointment, and this is the best hypoallergenic ointment you can use on the market. It's fantastic. It's prescription only. So this we use in a Q-tip and a cotton tip applicator, and you put a small amount on, and then you put it up inside the patient's nose. And we'll just demonstrate this. Up inside, you roll it around softly inside the nose in that area, and you do it bilaterally up inside the nose, and you roll it around in that area. Beautiful. And if there's any, and less is more, okay? And you put that on, and then the last thing is the steri strips. So you've had your splint taken off, and we'll give you a 4-week supply of steri strips, 3 to 4 weeks, and they're put on in this manner. Put them on right in the super tip area. You overlap them gently, and you put them all over the top of the nose. And there's 2 layers you can put on. Sometimes if you have significant swelling, we may put one on the bottom as well, but that's the basic one that we use. And then if and these stay on for 3 to 5 days, sometimes longer, and you change them with the shower. And then later on, if you have significant swelling, and often we give you this. This is an incredible tape that you can use that actually can be used additionally. This is a stretchy tape. So you can take the tape and stretch it, and it goes on top of the nose, especially in the tip. So you're stretching it and putting it on. And you do that and layer it just like you did the other, and it works beautifully. So this is done after the initial 3 to 4 weeks. So that should clarify everything you need to know about post-op care. The most important things are these 4 things you must do. The saline spray, the steroid nasal quart, the ointment up inside your nose, the mucopuricin is very good to allow for wound healing internally, and then the steri strips. So you've gotten all the instructions, and they're all in this nice little packet with a review form as well. And you'll also get some rhino shields. And these are wonderful because you can put those on the top of your nose when you're done, and then you can wear your sunglasses or glasses without having to tape anything. And I have you do that for at least the first 4 weeks.